Contents of the axilla. If you remember that day we have discussed about the axilla, what exactly the axilla is. Okay. Then what are the shape of the axilla, then boundaries of the axilla, contents of the axilla. Okay. Now in the contents of the axilla, the first and the important content is axillary artery. Now how to study the axillary artery? If any tubular structure is there, how we will study the tubular structure? What are the points that I have given? First will be the origin, then course, then termination, branches, area of supply, and yes, and important relations. Okay, and in some cases you must know the divisions or the parts of the artery. Okay. Now in case of arteries, branches are there. What about veins? In case of veins, it will be tributaries. In case of veins, it will be tributaries. Okay. So today I will show you one thing. Mostly in case of artery and vein, the starting and ending points, you will see they are opposite to each other. Okay. So you can see over here. I will show you the axillary artery and axillary vein. Okay. Now, what about the origin of the axillary artery? So when the subclavian artery is crossing the outer border of the first rib, it continues as axillary artery, as you can see in the diagram. Okay, so this is the axillary artery. Now where is the termination? When it is crossing the lower border of the teres major muscle. Okay, at that time it continues as brachial artery. So that is the termination, and in between, yes, that is the termination. Matlab artery is not directly terminating, artery is continuing, but the name of the artery is different. Okay, that they have given one example. You have heard about the aorta, largest artery. So when it is in the thorax, it is called as thoracic aorta. When it is in the abdomen, it is called as abdominal aorta. Okay, artery is same, just the name is different. Here also, see, subclavian artery, same artery is continuing, but here we call it as axillary artery, and here we call it as brachial artery. Okay, but in this case, what you have to know that this is the origin and this is the termination of the axillary artery. Actually artery terminate nahi ho raha hai, artery is continuing. Okay, but the axillary artery ends over there. तो ये हो गया origin, course, termination. Next what? Branches. Okay, now branches, it depends on the artery. All the arteries don't have similar branches. Depending on the area of supply, the branches are different. Okay, but when you will be studying the branches of, it's not like this that you have to study the branches of each and every artery of the body. ये possible नहीं है. ठीक है, तो selective arteries are there which you have to study, which you have to know the branches, which is important for the exam. If you take the example of axillary artery, how to remember the branches? That day I have written. First of all, how many parts are there of the axillary artery? 3 parts are there. Now how the parts are divided? One muscle is there, that is the pectoralis minor muscle. As you can see, the pectoralis minor muscle, it divides the artery into 3 parts. So the part between the proximal to the muscle is the first part, the part which is behind the muscle is the second part, and distal to the muscle is the third part. Okay, like these 3 parts are there of the axillary artery. And which muscle is dividing the axillary artery into 3 parts? Pectoralis minor muscle. Okay. Next, what you have to know? Next, you have to know is the branches. So always keep that in mind. From first part 1 branch, second part 2 branch, third part 3 branch. So total 6 branches are there. Okay. First part से एक ही branch, second part से 2, third part से 3. Like this, total we are getting 6 branches. Now, with the help of the branches, you have to know the area of supply. That will be the area of supply for axillary artery. In artery, I have mentioned that you have to know about the area of supply. So area of supply is directly depending on the branches, because जो main artery है, main stem है, वहाँ से जो branches निकलेगा, they will go and supply the various area. Okay, different areas. So that is the area of supply. So here along with the branches, if you know where the branch is going and it is supplying which structure, you will know the area of supply. Okay, so for that day I have discussed about this chart. If you remember that each and every part, the branches and the area of supply. Okay, that already we have discussed that day. So this is how you have to study the area of supply in case of axillary artery. Okay. Next, there is another diagram showing the branches. Okay, yeah, this is the diagram showing the relations of the axillary artery. Okay, so gradually as you will go in the different parts of the upper limb, for example, now you are in pectoral region, then you will come to the arm, then forearm, then you will go to the hand. Okay, at that time you will observe that those nerves, blood vessels which are present, along with that other structures are also passing. Okay, and you have to know the relation between the structures, especially when you will be studying about the areas, for example cubital fossa. Okay, in cubital fossa different structures are present. Now how those structures are oriented from medial to lateral or from lateral to medial. So like this you have to know the structure, and those are nothing but the relations. Okay, now here also, now in order to understand the relation easily, what we have done, we know that three parts are there of the axillary artery: first part, second part, third part. Okay, so as you can see, this is the diagram showing the first part, second part, third part. Now here the transverse section of the axillary artery is taken in three different parts. Okay, and then you can see the relation. Now if you want to know the direction, okay, I am talking about this diagram, then what will be the direction? It is like this. Okay, this is anterior, this is posterior, this is medial, and this is lateral. Okay, now compare with this. So whatever I have written in the board, compare this one with this diagram, you will understand. तो इसका मतलब क्या है? Can you see the red color circle? That is the axillary artery. ठीक है? In all three cases you can see the red color artery. For example, here also you can see one red color circle. Here you can see one red color circle. Here also you can see one red color circle. मतलब these are axillary artery. Three parts of the axillary artery. Now, which is the anterior, which is posterior in this diagram? See the leveling. This is the anterior. ठीक है? This is posterior. Here I am not writing because you can't erase. That's why I am not writing. This is anterior. This is posterior. ठीक है? This is medial and this is lateral. ठीक है? Now you see for the first part, anteriorly first you are getting the pectoralis major. Posteriorly we are getting the serratus anterior, that also the first digitation. Medially we are getting axillary vein. Now one important thing, if you have noticed that this axillary vein in all three parts, it lies medially. देखो, see in the diagram. Here also it is medially, there also it is medially, here also it is medially. Okay, so this relation is constant. Axillary vein का जो relation है with axillary artery, always it is situated medially. Okay, in some books it is written inferior medially. If you write medially, you are correct. Next, here if you go laterally, then you can see the lateral cord and posterior cord can be seen, and medial cord is situated posteriorly for the first part. Okay, next if you see the second part, anteriorly pectoralis major, pectoralis minor, both are present, and posteriorly subscapularis muscle is there. Medially this is constant, that is the axillary vein. Okay, laterally lateral cord hai, and medially medial cord. Okay, of the brachial plexus. You have studied about the brachial plexus, right? Brachial plexus ho gaya class mein. हाँ. Next, if you see the third part, okay, so in the third part, all around you will be getting at the different nerves or different branches of the brachial plexus. Okay, for example, median root of the median, this is anteriorly, axillary nerve and radial nerve situated posteriorly, ulnar nerve and medial cutaneous nerve medially, and laterally you can see the musculocutaneous nerve. Okay, So these are the relations of the axillary artery. Now this is very important because during the time of exam, the relations, you have to mention the relations also. So I think this diagram is a easy diagram to write the relations. Rest, I am not telling that this is the only diagram you have to draw. If you want, you can use this diagram. But I feel that this is a easy diagram to understand the relations of the axillary artery. Okay. Important part is the subscapular anastomosis. Several times I have mentioned about the subscapular scapular anastomosis. So what is this scapular anastomosis? First part, branches of the first part of subclavian artery and branches of the third part of axillary artery. Okay, what they do, they anastomose around the scapula, and this is called as scapular anastomosis, as you can see in the diagram. Okay, so see, this is the subclavian artery. Okay, and subclavian artery is only continuing as axillary artery. I have shown you in the previous diagram. ठीक है, तो ये subclavian artery है, and you can see it is continuing as axillary artery only. Now subclavian artery का जो first part है, from first part you can see the branches which are coming out. Now you have not studied about the subclavian artery, that we will study in case of thorax. After upper limb we will start with the thorax. At that time we will study the subclavian artery. ठीक है, so here you can see the first part of the subclavian artery, the branches which are coming out. Okay, and from the axillary, third part of the axillary artery, the branches which are coming out, they are anastomosing. ये जो symbol दिखाई दे रहा है, can you see one symbol? This is the symbol or sign of anastomosis. ठीक है, this is the sign or symbol of anastomosis. So this anastomosis is taking place around the scapula. Okay. Now particularly if you see around the scapula, collateral anastomosis is seen, okay, between the branches of first part of subclavian artery and third part of axillary artery. Now suprascapular and deep branch of the transverse cervical artery, suprascapular and deep branch of the transverse cervical artery, which is the thyrocervical trunk, branch of thyrocervical trunk, first part of the subclavian artery, and with circumflex scapular artery. And circumflex scapular artery, this is the circumflex scapular artery, from here it is coming out, that is the branch of third part of the axillary artery. Okay, in between them, around the scapula, most of the part of the scapula, the anastomosis is taking place. Now another anastomosis is taking place around the acromion process of the scapula. You know that different processes are there in scapula. Okay, coracoid process, acromion process, right? तो ये जो acromion process है, okay, ये देखो, ये जो acromion process है, around the acromion process, acromion branch of the suprascapular artery with thoracoacromial branch and posterior circumflex branch of the humeral artery. So around this, a anastomosis is taking place around the acromial process. Okay, that is called as scapular anastomosis. Now, why this anastomosis is important? If anyone asks you why those anastomoses are taking place, what is the answer? What will be the answer? ये सब anastomosis जो होता है, क्यों होता है? Any idea? Say, I will give you a very practical example. Whenever you are traveling somewhere, okay, whenever you are traveling somewhere, you always prefer highways, right? Now due to some reason, if a point of the highway is blocked, then what you will do? You will take a alternate or bypass, okay, and then you will reach your destination. तो ये भी सेम है, ठीक है? तो जो मेन आर्टरी होता है, if any of that particular part is blocked, through that alternate route the blood can go and circulate, and then it can supply that particular area. That's why these collateral anastomosis are present in our body. Okay, but there are certain areas in our body where those collateral circulations are not there. Okay, in that case those arteries are called as end arteries, END. Okay, END का मतलब क्या है? खत्म, हाँ. तो end arteries are there. certain areas in our body where such kind of anastomosis are not present. Best example is appendicular artery. It is the end artery. Okay, that artery is going and supplying. If there is any blockage, damage to that artery, that organ is gone. It will not get any blood supply. Okay, so those are called as end arteries, END. I hope the concept of collateral circulation is clear. Next is the axillary vein. Okay, let me show you the diagram first. Can you see the diagram of axillary vein? Okay. Now, what do you think? Where will be the origin of the axillary vein? देखो एक्सिलरी आर्टरी तो ऊपर से स्टार्ट हुआ था, ओके, कंटिन्यूएशन ऑफ द सबक्लेवियन आर्टरी, बट हियर इट इज नॉट लाइक दिस. हियर इट विल स्टार्ट फ्रॉम हियर. In this case it will start from here. That means it is the continuation of basilic vein. ठीक है. Now in upper limb, though we have not started with the arm and forearm, that's why you will not know about the basilic vein. But in our upper limb, two important veins are there: basilic vein and cephalic vein. ठीक है. As you can see, ये देखो, this is the basilic vein and this is the cephalic vein. Okay. And in between both the veins, median cubital vein is present, which is connecting both the veins, especially in the cubital fossa. So this basilic vein which is there, now this basilic vein is continuing as axillary vein. Okay. Now the axillary vein is nothing but the continuation of the basilic vein. Now it begins at the lower border of the teres major muscle. So previously in case of artery we have seen teres major muscle, the lower border where the axillary artery terminates and the brachial artery starts. But here what happens? The cephalic vein terminates and the axillary vein starts at the lower border of the teres major muscle. Ulta hota hai. Okay, completely opposite to each other. Because the direction of the flow of blood is opposite. That's why origin and insertion will also, origin and termination will also be opposite. Okay. Next, once it is flowing, it is joined by the brachial vein near the subscapularis and by the cephalic vein near the costal end. So you can see the brachial veins. यहाँ पे brachial veins रहता है. As you can see the brachial veins. These brachial veins are joining the axillary vein, and you can see the cephalic vein. It is also going and it is joining the axillary vein. Okay. Now I know you have studied the clavipectoral fascia. You have studied the clavipectoral fascia. याद है clavipectoral fascia? तो this cephalic vein, it pierces the, यहाँ पे जब जाएगा it pierces the clavipectoral fascia and then it will enter the axillary vein. So you must prepare the list of structures which pierces the clavipectoral fascia. Okay, everyone please note it down. Structures piercing the clavipectoral fascia. Find it out. Okay, next. So that is the origin. Now what will be the termination? Okay, when it will reach the outer border of the first rib. Okay, when it will reach the outer border of the first rib, and at that time it will continue as subclavian vein. That is the termination of axillary vein. Okay. Now when the axillary vein is passing through the axilla, you have to know that it is always situated medial to the axillary artery, and in between the axillary artery and axillary vein, mainly the medial cord of the brachial plexus is situated. Okay, and along with that the branches of the medial cord. Next are the tributaries. So in case of arteries, I have shown you the branches which are coming out, but here in case of veins, always keep that in mind, tributaries are there. Okay. Now the tributaries, second and third part of the axillary vein have tributaries that corresponds to the axillary artery. For example, thoracoacromial vein, lateral thoracic vein, subscapular vein, anterior circumflex, posterior circumflex humeral vein. Okay, these are the tributaries. So if you see these tributaries, these are similar to the arteries. Okay, that means जो artery निकलता है as a branch, same tributaries we are getting for the axillary vein. Okay, and if you see the axillary vein, it is draining the deoxygenated blood from the arm, axilla and superolateral chest wall. These are the areas. In case of axillary artery, I have mentioned the branches and area of supply. Okay. In case of axillary vein, what will be the answer? Area of drainage, means which particular area is drained by axillary vein. That is important. Have you got the point? In case of axillary artery, that is area of supply. But in case of vein, it is not area of supply. It is venous drainage. Means which area is drained by the axillary vein. मतलब कौन सा एरिया का जो डिऑक्सीजनेटेड ब्लड है उसको कैरी करता है एक्सिलरी वेन. दैट इज द एरिया ऑफ वेनस ड्रेनेज और वेनस ड्रेनेज ऑफ एक्सिलरी वेन. ठीक है. तो व्हिच आर द एरियाज? एज यू कैन सी फ्रॉम द आर्म, दैट मीन्स फ्रॉम द एंटायर अपर लिम्ब, that is then from the axilla and superolateral chest wall, superolateral area of the chest. These are the areas which are drained by the axillary vein. ठीक है. So these are the differences which you have to know between the arterial supply and venous drainage. Okay, we always mention it as or write it as venous drainage. Okay, and arterial supply. Now here you can see it is a beautiful diagram. ये देखो, ये this is the axillary vein and you can see these are the tributaries of the axillary vein. You can see these are the tributaries of the axillary vein. Okay. Okay. Now the last part, that is the axillary lymph nodes. Okay. So how many group of axillary lymph nodes are there? Total 5 groups of axillary lymph nodes are there. So mainly they are scattered in the fibrofatty tissue of the axilla. Okay. Total 20 to 30 numbers are there. So जो lymph nodes होता है 20 to 30 होता है in case of axillary lymph nodes. Now how they are arranged? They are arranged in 5 different groups, as you can see in the diagram. They are arranged in 5 different groups: apical, central, anterior, posterior and lateral. See, this is the apical, this is the anterior, this is the central, this is the posterior and this is the lateral. So this is how the lymph nodes are arranged. Now before going to the axillary group of lymph nodes, okay, when this particular terminology comes into your mind, what is your knowledge or how much you know or what you know about the lymphatic drainage? Here I have only mentioned about the axillary lymph nodes. ठीक है. Now in case of breast or mammary gland, you have seen that lymphatic drainage of breast is there. Whenever you are studying about any organ, ठीक है, उसमें पहले arterial supply आता है, venous drainage आता है, nerve supply आता है and lymphatic drainage आता है. If you have noticed. If not, just see what is written in the book. Okay, these points are mentioned. So from now onwards, as you will go after upper limb में तो direct organs नहीं है. As you will go towards thorax, abdomen, at that time you will be getting organs, different organs. ठीक है. तो whenever we are discussing about any organs, there are few points in anatomy which you must know. Okay, for example, first is the blood. In some book it is written as blood supply and then they have segregated it arterial supply, venous drainage. But in some books it is written arterial supply, venous drainage, then nerve supply of that organ, and after that lymphatic drainage. Okay, lymphatic drainage. Now what is the meaning of this lymphatic drainage? Now you have studied the breast. Now in breast it was mentioned that lymphatic drainage of breast. Okay, different lymph nodes are there which are draining the breast. Now what is the meaning of this? क्या समझ में आया है? If anyone asks you what is the meaning of this lymphatic drainage of breast, इसका meaning क्या है? Any idea? See, for that you have to decode the words lymphatic drainage. In case of lymphatic drainage, first you have to know what is lymph. Okay, and And next, though lymph nodes are mainly mentioned, now I am not going into the lymphatic system. You have to study about the lymphatic system. Though axillary lymph nodes are there, and you have used these axillary lymph nodes in case of mammary gland. So first, at least you must know what is lymph, and then you have to know what is lymph node. Okay, these are the two things which you must know, right? Or else you will not understand what is the lymphatic drainage. Now the question is, you know that lymphatic system is there in our body. Now the question is, what is this lymph? Yes, so it is a colorless tissue fluid. Okay, now how it is formed? Do you have any idea? First of all, it is a colorless tissue fluid which is having properties almost similar to the blood plasma, except the proteins which are present in the plasma. Okay, that is the lymph. Now the question is, how the lymph is formed? जो lymph formation होता है कैसे form होता है? When if you have noticed the capillary bed, ठीक है, capillary bed में क्या होता है? Arterial end होता है, venous end होता है, ठीक है. Now blood is coming from the arterial end, capillary bed is there, and then venous end is there. Okay, blood goes through the venous end. Now the rate of flow of blood in the capillaries are very slow. Artery में जितना fast होता है, capillary में flow is very slow. Because of that, what happens? The fluid which is present over there, it comes out into the interstitious or into the various intercellular spaces. In that spaces, the lymphatics are present, means the lymphatic vessels are present as blind end. Okay, तो ये capillary blood हो गया, ये blind ended lymphatics are present over there. So if you say suppose 100 ml of blood is passing, so among them approximately 90% of the blood will again go back to the venous system, and those 10% which comes out as the interstitial fluid, that will be carried by the lymphatic vessels because of the permeability of the lymphatic vessel. Okay, and then those fluid will pass through the lymphatic vessel, and from there the formation of the lymph has taken place, and then the flow of the lymph has taken place. Okay, and this flow is in one direction only. Now this will go and then finally it will drain into the venous system only. ये जो lymphatics का formation हुआ है, okay, it will go and it will drain directly into the venous system only. That's why the lymphatic system is also called as accessory of the venous system. Okay, now when the lymph is flowing, at that time it flows through different lymphoid organs. Among them, the most numerous are the lymph nodes. If you see the lymph nodes, they are almost kidney shaped. Okay, they are kidney shaped. So they are having one convex part and one concave part. जो lymph nodes होता है, ठीक है. Now this lymph will enter the lymph node through this convex part, ठीक है. And then here a hilum is there. Through that hilum the lymph is coming out. तो यहाँ से convex part से घुसेगा, concave part से निकल के आएगा. Now when it enters the lymph node, at that time the lymph is to get filtered. Okay, because that particular lymph is passing through different tissues. It is carrying different substances. Okay, so it gets filtered in the lymph nodes, and then the lymph which is coming out from the lymph node, that is the filtered lymph node. Along with that, whenever it is required, this lymph node will add some lymphocytes into the lymph as per requirement. Okay, so I am not going into more detail because those things we will study in lymphatic system chapter. Now in case of breast, what you have studied, that 75% of the lymph of the breast is drained by axillary group of lymph nodes, means these lymph nodes. इसका मतलब क्या है, breasts का जो lymphatic drainage है, okay, जो drain हो रहा है, ultimately they has to pass through these lymph nodes. Okay, now suppose cancer cell is present in the lymphatics of the breast. So what will happen? It will pass through this particular lymph nodes. Okay, it will pass through this particular lymph nodes. Then what will happen? It will get filtered. Once it is getting filtered, those cells will be trapped inside the lymph nodes because ये filter कर रहा है. Okay, as a result, what will happen? Those symptoms or those problems will be arised in this particular lymph node. Lymph nodes will get enlarged. Okay, and that can be felt by manual examination of the axillary lymph node. Okay, so whenever a person is having common problem, having early diagnosis with the breast cancer, at that time manual palpation of the lymph nodes, axillary lymph nodes are done to see whether lymph nodes are enlarged or not. Okay, if lymph nodes are enlarged, I am not telling in all the cases, in most of the cases it is suspected that CA breast is present. Okay, other problems may also be there. Because of the infection, it may get enlarged. Okay, so I hope you got an idea of what is lymph node, what is lymph, and what is the meaning of lymphatic drainage. Okay, now yes. Okay, now see here apical group. Now in case of lymph nodes, what you have to know, okay, and suppose agar question आया कि write a short note on lymphatic drainage of breast, or suppose axillary group of lymph nodes. What you have to know, first of all, you have to know the name of the group of lymph nodes. So in axillary, 5 group of lymph nodes are there. Okay, and you can see the location. Next, what you have to know? Next, you have to know that suppose anterior lymph nodes are there, anterior group of lymph nodes are there. Okay, where they are present and from where they are draining the lymph. These 2 points must be there. Okay, where they are present in the axilla. Axilla में कहाँ पे situation है, where they are located in the axilla, and from which area they are draining the lymph. These 2 things must be known. Okay, you must know these 2 things. So if you see the anterior group of lymph nodes are also called as pectoral. They lie along the lateral thoracic or long thoracic vessel. You can see this is the lateral thoracic vein or long thoracic vein. Along the long thoracic vein, this anterior group of lymph nodes are present. Okay, now from where they are draining the lymph? Most of the breast. Okay, they are draining the lymph from most of the breast. And along with that, anterior wall of the trunk. Anterior wall of the trunk and most of the breast is drained by this anterior lymph nodes. Okay, next is the posterior group of lymph nodes are also called as subscapular lymph nodes. Here you can see the posterior, this one, posterior lymph nodes. Now these posterior lymph nodes are present around the subscapular vein. Okay, which part is drained? Now this is draining most of the upper limb. Okay, the receive lymph from the posterior wall of the upper half of the trunk and axillary tail of the breast. Axillary tail of Spence, I hope you have heard of the mammary gland, from that particular part, and posterior half, upper half of the trunk, that is drained by the posterior group. Okay, next you can see the lateral group of lymph nodes. Okay, now this lateral group of lymph nodes are present around the upper part of the humerus. Okay, medial to the axillary vein. You can see this is the axillary vein, medial to the axillary vein they are present, and they are mainly draining the upper limb. Okay, most of the upper limb it is drained by them. Next is the central. Here you can see the central group. So central group का क्या function है? From these 3 group of lymph nodes, the lymph is going to the central group. Okay, that means from anterior, from posterior, and from lateral group of lymph nodes, the lymph is draining into the central group of lymph nodes. Okay, and along with that, some part of the breast, it is also receiving lymph from the some part of the breast. Okay, next is the apical group. Here you can see the apical group or infraclavicular, because this is the clavicle, it is situated just below. Okay, this is the apical group of lymph nodes. Now it is situated deep to the clavipectoral fascia. Okay, now they are having very important clinical significance because they are receiving lymph directly from the upper part of the breast and from the central nodes. So from here it will go to the apical part and also from the upper part of the breast. Okay, So from these two areas, the lymph is going over there. Now from this particular apical group of lymph nodes, if you see the lymph on the right side, it is different, and from the left side it is different. On the right side, it is draining into the subclavian trunk on the right side, and on the thoracic duct on the left side. Okay, now I will show you one diagram. If you see the diagram, तो ये देखो, this is the apical group of lymph nodes. From apical group of lymph nodes, on the right side it is going to the subclavian one, and on the left side it is going to the thoracic duct. Okay, thoracic duct is the largest lymphatic vessel of our body. Thoracic duct is the largest lymphatic vessel of our body. That is also in the thorax, so at that time we will discuss. Okay, now this is a beautiful diagram where you can see the different lymph nodes, okay, how they are connected, and from one lymph nodes how the lymph is flowing and ultimately where they are going. That can be seen over here. Okay, mainly you can see the afferent and efferent lymphatics from the axillary lymph nodes. Now what is the meaning of afferent and efferent? Do you have any idea? Afferent lymphatics means, suppose a lymph node is there, a particular area, from there lymphs are coming, okay, into the lymph node. Those will be the afferent. एक बार वहाँ filter हो गया, from there lymph is coming out and going to some other lymph nodes, that will be the efferent one. Okay, so for example, see, this is the efferent one, this is the afferent one. So this is the apical group of lymph nodes. So you can see from here it is coming, from here also it is coming to the apical group. So once it is coming, then these are the afferent. From apical it is going to the subclavian and thoracic duct, so that is the efferent. Okay, so that is all about the axillary lymph nodes. Okay, now in the axilla there are some important applied aspect also which you must know. Okay, now what are those applied aspects? So here you can see some important applied anatomy of the axilla. Okay, so what are those important applied aspects? So first of all, if there is dislocation of the shoulder, then what will happen? It will cause damage to the neurovascular structure which is present in the axilla. Okay, so this you will not understand because you have not studied the shoulder joint. Once you study the shoulder joint, you will understand this. Okay, next is the axillary lymphadenitis, means inflammation of the axillary lymph nodes, maybe due to malignancy or infection, okay, of the limb, breast, abdominal wall above the umbilicus. So from this particular area, the infection, the inflammation can spread up to the axillary lymph node, and then axillary lymph node can get inflamed. Okay, next, compression of the long thoracic nerve of Bell, okay, by enlarged central group of axillary lymph nodes can cause paralysis of the serratus anterior muscle. You have studied about the serratus anterior muscle. Okay, तो function क्या है serratus anterior muscle का? What is the action? Serratus anterior का, first of all, see, overhead abduction of the arm, that is done by the serratus anterior. Then pushing, punching movement, that is also done by the serratus anterior muscle. Okay, that's why in case of boxer, the जो boxing खेलता है, in those person, this is very strong serratus anterior muscle. Okay, whenever you are pushing, punching, in that serratus anterior muscle is very important. So if the long and this serratus anterior muscle is supplied by long thoracic nerve of Bell. Okay, now if that muscle is get paralyzed, then what will happen? Those movements will get affected. Okay, and there will be winging of scapula. Okay, so then that can be seen easily, the winging of scapula. Next is the thrombosis of the axillary artery because of the prolonged hyperabducted arm, especially in case of painting, plastering, sealing, or post-operative mastectomy with removal of axillary lymph node can lead to venous stasis and edema of the upper limb. Okay, so thrombosis of the axillary artery, axillary vein, if it is taking place. Now, if the hand is abducted for a longer period of time, at that time there may be edema in the upper limb. Okay, so there may be various reasons. Among them, few important reasons are post-operative mastectomy. What is mastectomy? Removal of the breast. Okay, then with removal of the axillary lymph nodes, so this will result to venous stasis, means flow of the blood in the vein will the velocity will decrease. As a result, in the surrounding tissue fluid will be accumulated, that is called as edema. Then thoracic outlet syndrome, this also you will not understand because this is completely related to thorax. Okay, तो उसमें क्या होता है, compression of the vessels and nerves in the axilla between the clavicle and first rib and the scapula, called the thoracic outlet syndrome. Next, surgical approach to the axilla. Now this is very important. In case of axilla, in the beginning I have mentioned that abscess in the axilla is very common. Okay, abscess in the axilla is very common. Now whenever abscess is there, or suppose other surgical procedures are done in the axilla, which is the safest way to do the or to make the incision in the axilla? Because if you want to enter the axilla, for example, if you want to enter this classroom, doors are present, so you can see the door, you can open the door and you can enter the classroom. Now suppose I have covered the doors with something. Now what you have to do? You have to find out the door, or you must know that in this particular area doors are present, right? So axilla में तो ऐसे open doors नहीं है. How you can enter? So the safest wall of the axilla is the floor of the axilla. That also, which part of the floor? In between the two axillary fold, midpoint of the two axillary fold. So that day I have mentioned that how many axillary folds are there? You are not revising anything. Two axillary folds are there, anterior and posterior axillary fold. Today what you will do, once you go to your room, you will stand in front of a mirror, do overhead abduction. ठीक है, at that time you will see the anterior and posterior axillary fold. ठीक है, दोनों axillary fold के बीच में the area which is the, that is the axilla. ठीक है, तो the center point of two axillary folds, okay, that also the floor, that is the safest area to take incision and do various surgical procedure in the axilla. Okay, because it will prevent the damage of other structures present in the axilla. ठीक है, important points related to the applied anatomy of axilla. ठीक है, now some important points, not all. Now what you have to do, you have to study books. Okay, in that you will see that at the end of the chapter, okay, the applied part they used to highlight in red color or in blue color, and then applied points are given. Most of the things I have covered. If few things are left in the book, please study from yourself, and after that if you are not understanding it, please come and ask. Okay, we'll discuss in the class, but most of the things are discussed. ठीक है, now those things which are not discussed, you may get question in the exam from those points also. Okay, तो जो discussed नहीं हुआ है, it's your duty to go and study, and after that we'll discuss in the class. ठीक है, so that is all about the axilla. Only this portion was left that day, so today I have completed these things.